Good afternoon.
Good
Myself Girish
afternoon.
Shankar, highly delighted to welcome one and all who joined on this virtual platform for APTI Maharashtra State Branch sponsored National Conference on Metabolomics. It is a it is a true pleasure to introduce our speaker today. We have invited Dr. Saeed Ahmed sir as a speaker for this third plenary session. He is a distinguished academician, researcher, and administrator with over 2 decades of expertise in herbal drugs, natural products, and traditional medicine. Currently serving as a professor in the Department of Pharmacognosy and Phytochemistry and head of the Department of Food Technology at Jamia Hamdard, New Delhi. He has played a pivotal role in advancing research and education in pharmacognosy, ethnopharmacology, and food technology. With a PhD in pharmacognosy and phytochemistry and postdoctoral experience at the Albert Einstein College of Medicine, New York, Dr. Ahmed has contributed significantly to global research collaborations. He has established state of the art facilities, including the Center of Excellence in Unani Medicine and the Bioactive Natural Product Laboratory at Jamia Hamdard. Dr. Ahmed has authored over 400 peer reviewed articles, 8 books, and 10 patents. His research focuses on metabolomics, chromatographic analysis, quality control of medicinal plants, and standardization of herbal drugs and traditional formulations. He has received numerous accolades, including the CST UP Young Scientist Award, DST Boys Cast Fellowship, UGC Research Award, SFE Young Ethnopharmacologist Award, and the APTI Manjusri Pal Best Pharmaceutical Scientist of the Year Award. An active member of the scientific community, Dr. Ahmed served on editorial boards of prestigious journals such as the Journal of Planar Chromatography, Modern TLC Springer, and Frontiers in Pharmacology. He is a member of the USP Botanical Dietary Supplements and Herbal Medicines Expert Committee USA, the Indian Pharmacopoeia Commission, and the Scientific Board of the HPTLC Association, Switzerland. Dr. Ahmed has led over 40 sponsored research projects and industry collaborations worth over 25 crore. He has organized 3 international conferences, 4 national seminars, and numerous workshops, delivering over 150 invited talks across 23 countries. Under his leadership, Jamia Hamdard has introduced new academic programs, including PhD in traditional Indian medicine and postgraduate courses in food technology. He has supervised 47 MPharm and 42 PhD scholars, in addition to 21 PhD candidates currently under his guidance. Dr. Ahmed's visionary leadership and contributions have established Jamia Hamdard as a global hub for research in traditional medicine, inspiring students and researchers worldwide. Today, such a renowned academician and researcher is associated with us on this virtual platform. He will be presenting on the topic of metabolomics in scientific validation of traditional claims of Ayush medicine. You are most welcome, sir. Now I request Dr. Syed Ahmed sir to proceed with your presentation. Sir, you can share the screen. Thank you.
Thank you very much for your nice introduction. I think I'm audible. I'm audible.
Yes, sir, you're clearly audible.
And my slides are visible.
Yes, sir, they are absolutely visible. Thank you, sir.
Okay. So thank you very much for inviting. In fact, thanks to Dr. Ganjiwal and IPER for inviting me, and thanks to APTI Maharashtra branch for organizing the such conference and on very burning topic, that is metabolomics. And so we'll start. In fact, today I was having some meeting in Ministry of Ayush and just reached here. And again, we have at 3:30 some foreign delegation is coming. So we'll be little quick and have some discussions on what is going on in metabolomics and how we can go ahead with plant metabolomics and drug discovery and how we can validate scientifically them. The traditional medicine, in fact. So that's what we are using through Ayush, including Ayurveda, Siddha, Unani, and many other systems. So throughout my presentation, approximately 40 to 45 minutes, we are going to have something about regulations and why we need metabolomics, and about my laboratory and what we are doing in my laboratory currently, and what we did since a few years back, and in metabolomic profiling for scientific validation of traditional claims. So starting from this presentation, and as you all know, that I belong to Jamia Hamdard, and this is the beautiful campus just in heart of Delhi, and you can see some pictures. This is the School of Pharmaceutical Education and Research, that is Rank One Pharmacy Institute, that you must be knowing. Many of you have visited even. So this is Center of Excellence. In fact, the laboratory that I have set up here in Jamia Hamdard, and that is a state-of-art laboratory having all those facilities required for drug discovery, and then including BSL-3 facility, all the things of for analysis, analytical laboratory, and pharmacognosy. I keep my video off because if we are going to on, it may create some problem in between. That's okay. If you need, I can on it, but sometimes it may create problem. Okay. And meanwhile, if you are any problem is there, you can interrupt with me. So this, you know, that Indian system of medicine is composed of 7 different systems of medicine, that is Ayurveda, Yoga, Naturopathy, Unani, Siddha, Sovarikpa, and Homeopathy. And then talking about, since I am heading one center of Ministry of Ayush, that is Center of Excellence, that's why, and on Unani medicine, so little bit I will talk on Unani medicine as well, you know, similar to Ayurveda. This is a system of medicine in which we are talking about various states of body in health and when not in health, and how we can come up to treat that and to restore that lost characters of the body. And then in fact mainly depends on different features, mainly the temperament. So temperament of drug and temperament of human, and then it is treated accordingly, and similar to, you can say, personalized type of medicine. So talking about herbal drugs and natural products, so if you see in India, so we have 2 types of medicine. One is ASU and H medicine, and second is modern medicine. So modern medicine, how it differs from Ayush medicine or ASU and H medicine, that is, it is completely characterized, whereas latter is not, that is ASU and H medicines are not completely characterized, and mainly composed of aqueous and hydroalcoholic extracts. So, what is global trend? In fact, how it is popular, because increasing interest on natural and alternative medicine, WHO recognition, and then rising demands of natural and holistic treatments, including yoga and TIM. But there are a lot of challenges that are regulatory, scientific, and other cultural barriers. So main challenges on the acceptability of Ayush medicine, lack of standardization, and limited scientific validation of the claims what we have, and then cultural barriers are still there in Indian and non-Indian population, then misrepresentation and many other things. Infrastructure and global chain supply is also one hurdle in popularization and globalization of herbal medicine. So what are the opportunities that mainly that we can focus, that is strengthening on the research, then global collaborations to educate them about Ayush medicine, then education, and then standardization of these formulations. So whole of the things that needs global collaborations and to conduct the outreach programs of all the stakeholders so that they can get aware them about Ayush and increase the acceptability. So what is the future scope in this? That is, that and in need of, so need is the scientific validation of traditional claims of all our medicines. Many of the diseases are there in which we do not have any modern treatment, like liver disorders, like kidney disorders, but those medicines are available in Ayush system. So the world is in fact deprived of using these medicines which we are using in Indian system. So in fact the whole of the global population is not using, but limited to Indian system, Indian region. So what we can do, in fact, if we can validate and produce them scientifically, then hopefully the whole globe can accept these formulations. There are many other things that we can go, that we can produce some synergy-based combinations and produce some modern data. Then we can go for phytopharmaceuticals. We can have some value-added extracts, and then Ayush Ahar is coming up, then nutraceuticals and veterinary segments. That many of the Ayush formulations are coming in nutraceutical segment, and since we cannot sell these medicines all across the globe as a medicine, okay, but we can sell them as the nutraceuticals. So many of the companies are coming as nutraceuticals, but what is the way forward? That is what would need that if we have any of the formulation, since it contains multiple constituents and only few of them like markers are not all the metaboloids. So what we can do, we can have a complete metabolite profiling and followed by pharmacokinetics and other studies needed in silico studies to prove the efficacy of our claims of traditional formulations. And even we can develop some multi-mechanistic synergy-based products, and that can be developed in Ayush mode as well as in modern system. But overall, what we can do right now, that we can have a metabolomic profiling and then network pharmacology to prove all of the things. Just you can how you can understand that what is metabolomics. Since 2 days you are in fact listening about metabolomics, you must be knowing. But as a pharmacognosist and the herbal drug and a chemist, how we can differentiate. Just an example, if you want to analyze the paracetamol, so if you are analyzing, it is having just one peak of paracetamol, okay, but if you are analyzing any herbal drug, just for an example, ashwagandha, it is having multiple components, okay. So how we can differentiate them? Just one thing I would like to tell you an example, like if you want to prepare a paracetamol tablet, suppose that 500 milligram tablet, what you do, that you take paracetamol, suppose that 100 tablets you want to prepare, you are taking 500 multiplied by 100 and whatever is coming, and then making dough and other things, mixing with the excipients and making the tablet. And then before moving it to the market, if it is registered, what we check, we ensure the content of paracetamol present in each tablet that should not vary more than plus minus 2%. That means the content of paracetamol in each tablet should be in between 490 to 510 milligram. If it is beyond that, either low or high, so it is not acceptable to the market. And unlike to that, if you go in any of the even curcumin tablet or any ashwagandha tablet or haldi tablet, okay, so if you cannot you are preparing in similar way, similar to that of paracetamol, but you cannot analyze the content of the preparation of the, even there is no regulation to analyze and check the content of those extract present in that formulation. And if we can do that, okay, so that is completely going to be equal to the that modern medicine, and that's what is the difference, and that's how everyone is asking about quality. And why we cannot do, because it contains multiple constituents, okay. So in multiple constituents and multiple type of chemistry is there, so we cannot analyze each and every constituent. So that was long back, but now even still following in our pharmacopoeias, very small parameters are there. But if we are talking about in modern, we have sophisticated instruments like MSMS, HRMS, and those things that we can analyze each and every component, and that's what it is, metabolomics. So in metabolomics, what we are doing, taking any of the extract that is using in traditional system, going for analysis using LPLC, MSMS, identifying their character, that compounds through dereplication studies, and then they're taking all those components and then doing some in silico analysis, finding out some network and networking them with the enzymes and genes responsible for different particular diseases, and working out on that how they are going to have a claim on those formulations. So this is the overall picture. That's what we are doing. Metabolomics is just, what is that? That is a study of complete set of metaboloids present in an organism at a particular time. Similar to that of proteomics, transcriptomics, and genomics. Just an example, genomics is nothing but the study of complete set of gene of an organism at a particular set of time, similar to that of metabolomics. And metabolomics as well, when we are talking about metabolomics of any formulation, that means identification and analysis of each and every constituents present in that extract or in that formulation. So if we talk about background is not very, you can say new. This is very old concept. Just that that identification of a sugar patient by identifying the presence of ions near the urine of that person. Similarly, Galen have given the theory of that humoral theory, and means color of humors like sputum, like urine, and that can tell presence of many of the diseases, and that shows presence of like bile in the urine, like sugar in the urine, that shows presence of one constituents, and so like bilirubin and like sugar, so those are showing presence of some specific constituents, okay. Similar to that, then 1940s, yeah, Roger William first identified the pattern of urine and saliva using paper chromatography, and find out that the paper chromatogram of schizophrenic patient is different and having some more component, and then identifying just one spot, and that shows the presence of schizophrenia in the patient. Similarly, Gary Suzak, one scientist that is working on LCMS, and they, in fact, he was having a business of sheep, and then what he did, he have seen that many of the sheep are not sleeping in the night. So he took the plasma of those sheep and analyzed, and he found that there is presence of an oleamide that in normal sheep, but it is reduced in the sleep deprived sheep. So that's how just identification of one component, that is oleamide, that can show in the population that this population is sleep deprived, and this is normal. So like that, a lot of different markers that we can use for identification of diseases. This is just one example of metabolomics. Similarly, in the plants, so we can use different technique for metabolomic profiling like NMR, UV, LCMS, TLC, and other things. Just an example of my laboratory. So my the examples, I'm going to put it here. That's from my laboratory. Just this is for one X. So how when we do, so like if we do through TLC only, so just a fingerprinting of different regions of a plant, this is going to give you a number of compounds, and those compounds cannot be analyzed in just by using Excel, but other statistical software are needed. And then we can correlate with the multivariate analysis using different statistical tools. So it's the use of a statistical tool and PCA analysis is compulsory in metabolomic profiling because of presence of big data in them. Like just one example, like this is amla and fruit, and then we have taken from 8 regions, and it shows presence of 160 metaboloids, and out of them 20 were major, but it is showing major components in uniform. But if we talk about minor component, they are varying. But when we have seen through metabolomic analysis, we have found that if it is corrected from near regions, so near regions are coming in same quadrangle here you can see, but if this is collected from one from Delhi, another from Bangalore, so they are in different way, but only minor components were showing variation, not the major components. So using metabolomic profiling, we can identify those things. Similarly, metabolomics can identify the differential metaboloids. Just an example of, that Senna. So many of you must be knowing, because all the pharmacy students know Senna since their first year. So Senna, we have Indian Senna, and then we have Alexandrian Senna. In Indian Senna, this is collected from Tenivali district, and that this contains one glycoside which is unique, that is tenevaline glycoside, and we can identify easily using metabolomic profiling. And this type of differential metaboloids we can identify using metabolomic profiling. Similarly, like I told you earlier, in the different diseases we can identify. So those things can be used for identification of different diseases. But if we are talking about doing metabolomic profiling for the formulations, it is very tough, because that if we talk about this traditional formulations, many of them are present in the form of used in the form of powder. Many of them are juices, extracts, distillates, unorganized plant materials, sometimes minerals, and that animal parts, and sometimes we are using hydroalcoholic or aqueous extract. Sometimes we are using gums, sometimes fixed oil and volatile oil. Chemistry of all of them are different. Since the chemistry is different, so it is very tough to analyze them using same technique. So it depends that what we want to do and which type of compound we want to analyze, and depending on that, we select the techniques, that is LCMS, GCMS, NMR, whatever is needed. And similar to that, if we talk about those formulations also, many of them are used as tablets. Some of them are like arqiyat, like aromatic water. Some of them are sugar-based, like khamira, like sharbat. Some of them are oil-based, and some of them are gaseous form. Their chemistry is completely different. So sample preparation is also a very tedious process that we need to go through. So depending on those chemistry, we use these techniques. And then just in fact, long back, around 10 years back, when I was going all across the globe for presentations on these traditional formulations, then there always the question how we came to that metabolomics, that everyone is asking, that you have multiple constituents, and then how you can check the quality, even if it contains hundreds of metaboloids, even if it is one, and you are claiming that you are identifying the markers, and then markers, there is nothing to do with the markers, since you have hundreds of metaboloids, each and every one you should identify. So when this question was raised. So at that time, we have very limited facilities, but we have GCMS. Then I thought to work on distillate, since there are many formulations used in traditional system in the form of distillates. Then I thought that since these are distillates, these are composed of volatile principles and mainly sesquiterpenes, and then all those sesquiterpenes can be analyzed through GCMS, and I was having in my laboratory at that time, and around 2010. Since then, I started working on metabolomics, and then because I thought that since each and every compound can be analyzed through GCMS, so we can go ahead with at least archaeat to see that these archaeat contains this much number of metaboloids and nothing less and nothing more. Okay. So we have taken many of the archaeat, those were mentioned in the pharmacopoeia, especially in the Unani pharmacopoeia of India. And then we prepared them in our laboratory and then got the fingerprinting. And then these are having some major components. Many of them are minor components, approximately 60 to 70 metaboloids are present in each of them. And but the major one are listed here. Then we did also pattern recognition analysis. That means, that if you are taking those formulations, they are going to get absorbed in the blood. And if these are absorbed in the blood and bioavailable, then they are showing the biological activity. And that is because of presence of bioavailable metaboloids only. So we have given a dose of that aromatic waters to the this animals, and then took the blood and then again analyzed and find out how much difference is there, how many metaboloids are present in archaeat and how many are present in plasma. And that is known as pattern recognition analysis. At a different time intervals, we identified the number of metaboloids and what were major metaboloids bioavailable that we have listed here. And what we can do, we can take the major metaboloids which are present in the plasma, we go for pharmacokinetic analysis, and then have some in silico analysis to scientifically validate them or their usage in traditional system of medicine. And then we did some stability studies also, because there were many things like when these pupils were storing, industrial pupils were storing these aromatic waters, then after 6 months they are getting some growth of fungi, so it was necessary to work out on their shelf life. So we also studied their shelf life using those major metaboloids present in them. Okay. Then, like just one example here of R-chemicoi and casni that is used in fatty liver disease. So if we analyze R-chemicoi, it is containing 56 metaboloids, but if we go for pattern recognition, it is showing about 38 metaboloids which are bioavailable, out of which only 5-6 were major, and we did in silico analysis. And then did in vivo and even the clinical studies to prove that which metaboloids were active. Similar to that, we did on many of the formulations, few are I am showing here. So one is like etrifal. So etrifal is like just trifala type of formulations, and but having sugar in them. So these were prepared in our laboratory, their quality control, their HPTLC fingerprinting, quantification of some markers, and then similar to that, metabolomic profiling, that how many metaboloids they are having. It is approximately 10 to 11 etrifals, showing one here, the major compounds present in them. And then, like hydroalcoholic and aqueous extracts. And then their shelf life also taking their in pharmacokinetic analysis using major metaboloids present in them. Okay. Then coming to be a pattern recognition on the same way, and the metaboloids present in different time intervals. Okay. So these were the major metaboloids at different time intervals in etrifal zaman, even perfala. And then how we can predict using network pharmacology, that you can see it here using in silico analysis. So like this we are doing. Then we are doing also some work on high throughput screening using bioautographic studies. So like, what is bioautography that we can do on the TLC plate. Just here one example, like different activities that we can do. So like this is the TLC fingerprint. So if you take a plate, one to know that which one is antioxidant, at least through DPPH activity. If you dip this plate, so all the compounds which are antioxidants are getting yellow in color, rest other plate is getting purple because of presence of that DPPH. And then if you can scrap this out, the yellow colored spot. So what we do when we run the TLC in this case, then we have a parallel TLC. One TLC we are going to dip, and other parallel spots we are going to get scrapped from the plate, and then dissolve in methanol, go for LC-MS analysis, identify those compounds. So several plants that you must be knowing, these are used in diabetes a lot, and then DPPH, alpha amylase, alpha glucosidase activities that we did identify those major compounds. And for biological activity, similarly, we can go for antimicrobial activity using this bioautographic technique. So similar to that, if we run TLC and find out the spots, and then if we can store it in a Petri plate containing bacteria, and then we can grow it, we can find out the spots, and depending on the growth of that using MTTSA, and we can identify, similar to that, the compounds responsible for antimicrobial activity. Similar to that, we can go for development of synergy-based patentable formulation using scientific validation. So like one phytomap that we developed in our laboratory, that is for Mycobacterium avium paratuberculosis, in which in fact this is one disease, Crohn's disease, that is autoimmune disorder present in livestock, and this is very rare and untreatable. So livestock means from cow and buffalo, we are getting infected, and it is also producing similar type of disease in humans also, but it is very tough to treat. And then there was a call from BBT to submit some projects on this, and then we submitted and got it. And then we worked on this. How we worked on this is we wanted to develop a product. So for development of a product, it is necessary that and launching in the market, it is necessary that the drug should be at least listed in Schedule 1, or it should be part of pharmacopoeia, whether Ayurvedic or Unani or any other pharmacopoeia of India. And then we selected the plants depending on their anti-inflammatory, immunomodulatory, and antimicrobial properties from this API and UPI. So we selected about 234 plants, and then removing duplicates and further screening to 173, and finally selected 207 plants, and 70 plants, and then 70 plants we have did a lot of exercise. We did literature search, bibliometric analysis, and other things, and find out which one is listed how. So most in all those analysis, we found that on priority for this disease, we have a cannabis sativa, solanum, osimum septum, colotopis procera. Out of these, we wanted to select. So since cannabis was banned, we selected solanum, and second we selected the osimum, okay, to work on this. And we prepared their extract and tested in this bacteria using anti-map activity, and then find out their MIC. Then we developed their different combinations and find one combination that was most active and producing synergy-based combination. And after development of that formulation, we tested their immunomodulatory activity in animal models and did different other activities. And then all other parameters also, we did anti-map activity in livestock also. And then did a lot of other studies to prove its effects. And Further, we did the quality control studies of that. In quality control, we did the HPTLC analysis of different markers, approximately four markers in each of the plant, and then did the validation and other things, and then metabolomic profiling also using LCMS, and then through LCMS, we quantified all those components present in them and did that pattern recognition analysis. So in different extracts in the formulation, and so like this, we got different compounds at different time intervals in different groups, and top 20 metabolites, did in silico analysis after pharmacokinetics and proved that how they are going to be effective, and then develop those formulations, get registered, patented, and many other publications for animals and humans also. So then similar to that, we developed some synergy-based combination for learning and memory also, in using different plants which are used in Indian system of medicine. So approximately 30 plants we screened, out of which we got the best result in Vidania somnifera and myristica fragrance, out of which there in fraction we identified all those metabolites present in them, showing that against Alzheimer's, published them in frontiers after patenting, and then similar to that, we developed some synergy-based brain tonic combination, and studied their all those activities, did metabolomic profiling, identified the responsible compounds through TLC bioautography, and then also in silico analysis to prove their biology and network pharmacological studies as well, and to come out that how they are going to be effective. Okay, then identified the compounds present in the formulations and which are responsible for the biological activity, and published their papers. Since this is part of Indian system of medicine, we were unable to patent this. Then similar to that, we are doing, like in our laboratory right now, we are doing some activity on kidney disorders, and for which we selected about 23 plants, 21 plants, and out of which are used in Indian system of medicine, and find out how much reports they are having, and on the basis of reports already available and different other literatures, we studied them as well in our laboratory, find in an HEK cell lines, and find out this. Few of them are having good activity, but selected APM gravulence and diocoscarota, which are showing the best activity, and their combinations. We have made a combination of approximately 96 combination in 96 well played, and out of which this one is showing here is the best activity as per their CI index. Then did the activity also in zebrafish model, including their toxicity, and then have seen about proteinuria, identified the content of creatinine they are going to release, and even glomerular filtration rate after injection of rhodamine. And through this, we in fact identified that how they are going to be active, this best combination. Similar to that, we do a lot of activities in our laboratory, and do some like for kidney disorders. We did some other formulation like Sharbat-e-Bazuri Moth-Dil one formulation was there. For that, we identified maximum of the metabolites present in them. Did some in silico and other studies as well to prove scientifically that how they are going to be effective. And see just one example quick. We'll see that how we are doing work in our laboratory. Here you can see this is the zebrafish model, zebrafish laboratory we have here in our laboratory. And this is just one moving is just 0.25 hours post fertilization, and then this is 4 hour post fertilization egg, in which we are doing this toxicity studies, and then this is 14-hour post-fertilization. You can see the development of organs in them. It started at 14 hours. Must be knowing that in zebrafish, this is embryo is going to develop in complete organism in 96 hours. That means whatever the human is developed in nine months, that is crisp in 96 hours in zebrafish. So we can see each and every organ development in just 96 hours. And since the whole of the fish is transparent, we can observe under microscope development of each and every organ. Here at 48 hours, you can see this heartbeat, you can see, and flow of fluids in this starting in approximately 42 hours, and it is going to develop in 96 hours. So here up to 120 hours post fertilization. Okay. Also, like this, we are doing different activities like toxicity studies, the different concentrations in zebrafish, and here you can see. So if you can see, this is a normal zebrafish here on the left panel, and then here on the right panel, you can see if we take a glass rod and shake on this water in the tank, then it is going to depress. So on depression, it is going to move only on the periphery. And if you want to test a drug, antidepressant drug. So this is I'm showing just one model of animal model, how we develop and how it is working. So if you want to test a antidepressant drug, just put the concentration, that is safe concentration of the drug in this tank, and then you can observe that presence of that fish in around the periphery or around the center. Here you can see that we can observe whole of this time, that is retention time in throughout the tank or in the periphery through camera and through one software. And that's how we do different activities like on zebrafish model and other animal models too. Okay. So a lot of activities that we do here in our lab that you can see here. Some glimpse of the laboratory that we developed at Center of Excellence in Unani Medicine. Yeah. Thank you very much for your patience. I know that I was very quick, and but you are most welcome to have any question, and then further, if anyone want to do any of the activity or any of the research work here at Center of Excellence, we are much open, and anytime you can come join and do your work here. In fact, even we are not going to charge any money from any of the students, but you have to come here and do your work by your own self. Thank you very much once again. Be happy to answer any question after.
Now session is open for discussion. If participants have any queries, they can ask the question. Any question from participants?
Thank you, Dr. Saeed.
Thank you very much, sir, for inviting.
I think there is no any question from the participants.
Mhm.
On behalf of Institute of Pharmaceutical Education and Research, Wardha, my sincere thanks for your exceptional presentation at this event. Your insights and expertise made a significant impact, and we are grateful for your valuable contribution. Thank you again for sharing your knowledge and making our event a success. Thank you very much.
Thank you very much, sir. In fact, metabolomics is a topic, in fact, that should be dealt in physical. And many of you have enjoyed it much when it had been physical, but since we could not do each and everything physical, and this is just I can say that crisp of the thing that what we can do, just a glimpse of the things that what we are doing in the laboratory, and how we can realize, how we can develop a drug, how we can validate them scientifically to improve the knowledge of IU system of medicine, and in fact, drug discovery from Indian system of medicine. That's what I can say. And all are open, and you can write me on my email, or you can call me whenever is needed. Any of the students. Okay. Thank you once again.
Thank you, sir. Thank you.
Welcome. Most welcome. So now, may I leave?
Thank you, Said sir, for excellent presentation and very excellent lecture. Thank you, sir. On behalf of IPER, the organizing committee is very much grateful to you for your excellent presentation. Thank you once again, sir. Thank you.
Thank you very much.
Thank you, sir.
Okay, most welcome. Most welcome. If anyone want to ask the question, they can write you, and you can reach to me anytime on my email. Thank you once again. I'm
Dr.
leaving
Saeed,
now. Ji sir.
Dr. Saeed, sir.
Okay, sir.
Ji
Thank
sir.
you, sir.
Next time I will try to hold a conference in physical mode, then definitely I will invite you over there.
Okay, sir. Thank you, sir.
On the same topic, sir.
Yes, no problem at all. They will enjoy. Everyone will enjoy. But
We will also enjoy,
yeah.
sir. We'll also enjoy very much the presentation. Thank you, sir,
Yeah.
once again.
Most welcome, ma'am. Most welcome.
देवाने देख लो हो गया है।
अपना ओरिजिनल स्लाइड Good afternoon, everyone. I hope you all had an enriching and insightful experience over the course of e-National Conference on Metabolomics. As we now come to the valedictory session, it's my privilege to guide you through the final moments of this remarkable gathering. Over the past 2 days, we have had the honor of listening to some of the most distinguished minds in the field of metabolomics, from thought-provoking keynote to the plenary sessions. We extend our heartfelt thanks to all the speakers for sharing their expertise and time so generously. Before we conclude, I would now like to invite Dr. Rajendra Ganjiwale, sir, Principal IPER, to deliver the valedictory address. Dr. Rajendra Ganjiwale, sir, to deliver.
Good afternoon, one and all. So, distinguished speakers, dear delegates, faculty members, and the students. Now, again, one heartily welcome to you for this valedictory program. As we come to the conclusion of this remarkable in-conference on metabolomics, I take this immense pride and pleasure in delivering the valedictory address. Over the past 2 days, we have witnessed an inspiring exchange of knowledge, ideas, and a research breakthrough from the experts. This virtual platform has transcended the physical boundaries and connected minds united by a shared purpose to advance the science of metabolomics and its application in solving the real-world challenge. From the opening keynote to the final discussion, each session has added a valuable layer to our understanding, whether in disease, diagnostic, environmental monitoring, and architecture. The depth of diversity of topics covered have been nothing short of exceptional. As a principal of this institution, it fills me with pride to see the engagement, enthusiasm, and the scholarly spirit demonstrated by our faculty, students, and collaborators. This conference has not only been an academic milestone for our institution, but also a reflection of our commitment to fostering innovation and global scientific dialogues. I would like to specially commend the organizing committee for their meticulous planning and execution. Hosting the virtual conference of the scale is no small feat, and a seamless coordination of session, technical support, and the speaker's engagement has been truly commendable. My special thanks to our keynote speaker, Dr. Shyam Kumar Maskapalli sir, and other session speakers, Dr. Kanaiya Kumar sir, Dr. Dada Saheb Kokre sir, and Dr. Saeed Ahmad sir. Thank you for your time, expertise, and contribution. I'm also thankful to all participants. Thank you for your active involvement. I encourage you to carry forward the learnings from this conference into your research, classroom, and communities. I'm also thankful to the chairman of my institute, Honorable Dr. Nitinji Dhande sir, President VYWS, and all office bearers of the VYWS, particularly Advocate Deshmukh sir, Dr. Hemant Deshmukh sir, Sri YV Chaudhary sir, Sri Husesai Pankajji Deshmukh, and Vinayji Gohad sir. In closing, I extend my heartfelt gratitude to all who made this conference a success. May the spirit of inquiry and collaboration continue to guide us as we work together to understand our life and its most fundamental levels. Thank you, stay safe, and I wish all the continued success in your future endeavor. Thank you very much.
Thank you, sir, for your thoughtful words. We now move on to acknowledging the efforts behind the scenes. A conference of this scale is only possible due to the commitment of the entire team. We express our sincere gratitude to the organizing committee, technical team, and every contributor who made this virtual event a seamless and impactful. A special thanks goes to our sponsors, MSAPTI, for their support. Lastly, a big thank you to all the participants, researchers, and attendees from across the country. Your active involvement made this conference a vibrant and engaging platform. Now, I would like to request Dr. Dilesh Singhvi, sir, to give vote of thanks. Dr. Dilesh Singhvi, sir.
Yes, good evening, everyone. We are nearing the finish of a 2-day online national conference. I am delighted to be here on the behalf of the Institute of Pharmaceutical Education and Research, Wardha, to express my gratitude. I want to start by sincerely thanking God Almighty for making today's event a huge success. We are able to make this this conference where it was because of His grace and blessings. I want to begin by expressing my gratitude to Dr. Nitin Dhande sir, President of the Vidarbha Youth Welfare Society, Amravati, as well as to all the esteemed management members who have always supported our efforts and inspired to us pursue excellence. I must express my sincere gratitude to Dr. Shri Jain sir, the Vice President of the APTI Maharashtra State, for his helpful assistance and collaboration. We would especially want to thank Dr. Aru Ganjiwale sir, the esteemed principal of the Institute of Pharmaceutical Education and Research in Wardha, for inspiring us to strive for excellence and for being our pillar of support. And also, we all know that expressing thank you is a courteous approach to show appreciation to a person, but this word would be less for our conference guest speaker, Professor Dr. Shyam Kumar Masakapalli, Professor the School of Biosciences and Bioengineering, IIT Mandi, Himachal Pradesh, Professor Dr. Kanhaiya Kumar, Senior Scientist, Fermentation and Macrobiology, Biotechnology, CSI, Indian Institute of Integrative Medicine, Jammu, India, Dr. Dadasaheb M. Kokre, Professor of Pharmacology, UDPS Nagpur, Dr. Saeed Ahmad, Director, Center of Excellence in Unani Medicine, Professor of Department of Pharmacognosy and Phytochemistry, School of Pharmaceutical Education and Research, who deserves special recognition for accepting our invitation, being here with us, and throwing lights on our various aspects related to metabolomics. I would want to thank Dr. Manisha Purani, this conference coordinator and professor and head of the QA department at IPER, for her steadfast support in the growth and development of the institution QA department. It is not something that occurs overnight. Week ago, the wheel started to turn. It necessitates for forethought
and keen eye for detail. We have been fortunate to be supported by a team of proactive and dedicated members of our institution staff who are professional in their field. I would fail in my responsibility if I didn't communicate my appreciation to my co-workers, Dr. L.G. Rathi sir, Mr. Sunil Devani sir, Mr. Abhiram Deshmukh sir, Dr. Rilesh Karande, Mr. G.D. Dahikar sir, Ms. Sheetal Tiple, and Ms. Yogita Mude. Let us applaud and express our heartfelt gratitude to all IPER teaching and non-teaching staff who contributed to the conference success, especially non-teaching staff, Mr. Daivalkar, Nitesh Tapre, Shubham. Then around 180 delegates from our various institutes in Maharashtra and other states were invited to attend. This made the conference a huge success because it was able to draw the attention of all eager and motivated faculty, research scholars, undergraduate, graduate students who want to study and explore. Since learning fosters growth, it's always an excellent approach to fuel our mind. Through these educational conference sessions, we get the opportunity to expand our knowledge and gain a unique perspective on a subject that may be new to us. Therefore, I want to take a moment to express my gratitude to our beloved audience for joining us. Lastly, I want to express my gratitude to each and every one of you for your involvement and support in helping to make this conference a huge success. I appreciate everything you have done and your contribution have not gone unappreciated. I want to conclude by saying that without the help and diligence of all of you, this event would not have been possible. I want to thank each and every one of you on behalf of the Institute of Pharmaceutical Education and Research, Wardha. Many thanks. Now, participants of the conference are further requested to fill the one Google form feedback link posted in the Zoom workplace chat box. Please fill the one Google form that is of feedback link that posted in the Zoom workplace chat box. You can find this in chat box. See in your Zoom app in the chat box, the Google feedback link is provided. Please fill it and submit.
Thank you. Thank you, Dr. Singhvi. Before we officially close, may I request all attendees to kindly fill the feedback form shared in the Zoom workplace chat box. Your input will help us make the future events even better. With that, we bring this e-national conference on metabolomics to a close. Let's continue to collaborate, share, and innovate because science never stops. Thank you once again, and we wish you all the very best. Stay safe. Stay curious. Thank you very much from IPER. Thank you, dear delegates. Filling the feedback form is necessary for getting the certificate. So it's a request to you all, kindly fill the Google feedback form for getting the certificate. Your certificate will get generated only after submitting the feedback form. Take the note. Thank you once again. Thank you very much.